So while you have the algorithm for schizophrenia and depression, we have a lot of concern by the patients. Like, for example, before treatment, patients are asked, do I require treatment now? Where could I seek for help? Would there be any side effects? Is the treatment affordable? Will my medical report be kept confidential? How would they view me if, let's say, I have been diagnosed with mental disorder? And during the treatment, patients are asked, how long do I have to be on medication? How shall I manage my condition? How to handle side effects? Should I stop my treatment? How shall I move on from here? So I understand that you have very tight schedule. Sometimes you have a long queue outside, waiting to speak to you. So I guess you wouldn't have a lot of time to educate them on that. So that's what all the VWOs has been doing here. It's never easy to convince someone to seek for help. We tried really hard. Some will take, if those who are positive will take few weeks. Some will be months, and some even years. And at times when patients are open to seeking treatment, it's the caregivers who discourage them from doing so due to stigma or stigma denial. So we have a lot of problems here. So talking about stigma and discrimination, so how did it develop? That's when people notice a difference, people develop an attitude towards the difference. And so we have stigma, which is a belief that we hold about someone, discrimination and expression of negative attitudes. Patients face stigma, mental health staff do face stigma, and I believe some of the GPs who are treating people with mental illness do experience stigma as well. So you see this article, it was very popular and debated on the line, internet, after Glenn actually observed a lady, having or exhibiting strange behavior in the cafe, and he shared his personal experience on the radio, and a lot of people were bombarding, and I've been receiving a lot of calls from patients telling me that, Porsche, how could Glenn make such remark? It's so discouraging. So you can't blame Glenn. Maybe, it's because he noticed a difference, and that's why he developed this attitude. So we really need to work hard to educate the public. You can't blame them at all. So, yeah, we work closely with ministers, members of the parliament, grassroots leaders, government agency, and these are some of the case studies we have. There's a case that happened at Hague Road where, this guy will always carry this, the last picture. This is a component of a TV. And he started telling everybody, or the police, or the member of parliament, saying that somebody has been entering my house, planting this component at the back of my TV. The brand of my TV is Sony, but I realized that this component is made in Malaysia. So definitely somebody has entered my house and planted this component at the back of my TV to monitor my movement. And you will see that he actually barricaded with the cardboard, to his bedrooms. He said, I'm blocking the ghost from entering my room. And you see that there's a pole with this cardboard. That's his weapon, In case the ghost come nearer to me, I'll hit the ghost with this weapon. It's so real to him. And he actually shifted his mattress into this storeroom. He felt that he's very safe within the four walls. And he tied a lot of ribbons at his window grill, ribbons or with plastic bags or whatever to tighten it because the ghost is entering from that window particularly. And you see that that's a picture of this pair of goggles that he'll wear in the middle of the night, saying that the ghost will spray water into his pair of eyes. So to him, it's very real, and actually has delayed his treatment for almost 4 years. And his family members left him alone, thinking that he's a freak. And, for the local community, they try to keep, close one eye, thinking that everything is fine, he'll be fine soon. But it went on for 4 years, and he started behaving, such way. And he has been, disturbing the police. And every now and then, he'll carry the component of the TV to the Meet the People session and telling the member of parliament, can you please do something? Somebody has been entering my house. So that's how we partner with all this member of parliament. They refer the case to us, and we are not there to diagnose. We are not there to take away your job, okay? We are there to actually, to assess whether this person, might be exhibiting some signs in terms of mental illness, so we can refer them to, nice people like you for treatment, and prescribe with some medication and stabilize. And now he's receiving medication. He has been stabilized, and he moved on with his life. And next, what do we have? There's a hoarding case at Hougang. It's a very sad case where there's old woman, 50 years old, having hoarding behavior, and the daughter actually wrote to the member of parliament saying that there's somebody in my family having this hoarding behavior, and can you please do something, as if the mother is not the family member. And then again, we mobilize our team to assess the condition, and telling the daughter, exhibiting maybe some signs, symptoms of OCD. She needs help, and again we refer them to the appropriate treatment. And this lady has already stabilized,